Okay, let's dive right into this. We're talking about a condition that is every bit as alarming as it sounds: feline skin fragility syndrome. It's a topic that goes right to the heart of an animal's defense system and, well, what happens when that fundamental defense just fails?
Just try to wrap your head around that for a second. An animal's skin is its shield, right? It's the first and most important line of defense against pretty much everything. But what if that shield, through no fault of its own, just lost all its strength? This isn't some weird what-if scenario. For some cats, it's a shocking and devastating reality.
Right, so this isn't just a scary thought. It's a real and frankly devastating medical condition. So let's explore what this fragile armor really is, what on earth causes it, and what it means for the poor cats who have to suffer through it.
You know, we totally take our skin for granted, but it's an absolutely incredible organ. It's resilient, it provides structure, protection, the whole shebang. And understanding how well it normally works is key to really grasping just how catastrophic it is when this vital shield gets compromised.
So, when this shield fails, vets don't just see it as a problem. No, they see it as an outright emergency. Let's get into the clinical details of what that actually looks like.
Okay, so here's the official definition. The keywords to really latch onto here are acquired, meaning cats aren't born with this, and minimal trauma. I mean, we are talking about the skin tearing from something as simple as routine petting or even just the cat grooming itself.
And this quote right here, it really just hammers home the severity. We're not talking about a simple rash or a minor irritation. In the veterinary world, this is considered a true 5-alarm fire emergency that needs immediate and intensive care.
Now, what this looks like is pretty shocking. The description of skin as tissue paper-like is, wow, that's incredibly evocative, isn't it? The wounds themselves are also really unusual. They often have very little bleeding because the skin is just so thin, but that also makes them an absolute nightmare to try and suture or manage. And as if that wasn't enough, these cats can sometimes have a mite infestation at the same time, which just complicates the whole picture.
So, here's the crucial point. This terrifying skin condition isn't actually the root disease. It's a symptom. It's a giant blinking red flag that's pointing to a much deeper, underlying problem that has to be uncovered. And so if you look at this chart, you can kind of see the breakdown. About half of all cases are caused by an endocrinopathy, which is just a disorder of the hormone system. But look at the other pieces of the pie. It can also be iatrogenic, which is a fancy word for being caused by medications, or even neoplastic, which means there's an underlying cancer.
But regardless of the specific disease, the biological mechanism is the same. All of these underlying conditions mess with the body's ability to produce collagen, and you can think of collagen as the rebar or the scaffolding inside a building. Without it, the entire structure, in this case the skin, loses all its strength and just falls apart.
This table really drives home the detective work a vet has to do. It's not one single cause. They have to investigate everything from hormonal disorders to reactions from steroid medications, liver disease, anorexia, and even devastating diseases like feline infectious peritonitis or cancer. Each one of those possibilities requires a completely different diagnostic path.
And this brings us to the investigation itself. I mean, when your patient's skin can tear from the slightest touch, how do you safely run the test you need to find the cause? It has to be an incredibly delicate process.
The approach has to be systematic and just super cautious. It starts with the least invasive steps, like checking the cat's history and collecting urine, without really handling the patient much at all. For anything more involved, like blood work or an ultrasound, the cat is actually sedated to prevent any movement that could cause a catastrophic tear. And notice that last step. They use fine needle aspiration for samples, which is way less traumatic than a full surgical biopsy.
This slide is so important because it just highlights the stakes. Every single action, even things that are totally routine in a vet clinic, like clipping fur or drawing blood, becomes a high-risk procedure. Even just plucking a few hairs to check for mites could cause a significant wound. The level of care required is just immense.
So all of this investigation leads to the most critical question. What's the prognosis? After everything we've talked about, what hope is there for a cat with this syndrome?
And the answer, unfortunately, is complicated. For many cats, the prognosis is grave. This is especially true when the skin fragility is a symptom of a severe, life-limiting disease like cancer. However, there is a glimmer of hope. If the syndrome is iatrogenic, caused by a medication that can be stopped, or linked to something manageable like anorexia, the skin condition is actually potentially reversible.
And this brings us right to the heart of the matter. Beyond all the diagnostics and treatments, the central issue becomes the cat's quality of life.
This isn't a conversation for later. It's a discussion that has to be started immediately between the veterinary team and the owner to make sure the animal's comfort and dignity are the absolute top priority.
So feline skin fragility syndrome is a dramatic and, let's be honest, often tragic condition. But it serves as such a powerful reminder that our pets can be facing these immense, hidden battles. And it really leaves us with a critical question. What does a syndrome like this teach all of us about the profound importance of paying close attention to the subtle changes in our animals' health?